afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-designee Andrea. Our guest today is Dr. Rachael Williams, the Chief Medical Officer for Milwaukee Health Services Incorporated, a federally qualified community health center. And available to answer questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestuen, the Chief Legal Counsel for the Governor's Office. We begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks so much for being here today. I hope you had a safe Memorial Day. As with so many things, this year was certainly different, but I know that many Wisconsinites were able to find ways to safely enjoy the long weekend. There were socially distant cookouts with just a few close friends and family, bike rides and picnics, and even some fireworks. The weather was ideal for visiting our state parks. I'm told that a number of folks were able to do just that. More importantly, I hope that everyone had a chance to reflect on the reason we commemorate Memorial Day each year, to recognize and honor the brave men and women who made the ultimate sacrifice to protect our freedoms and pay our respect to the families and loved ones they've left behind. As we continue to navigate these incredibly difficult times, I hope we can all remind ourselves from time to time that we should strive to be worthy of their sacrifice. Everyone can play a part in keeping our communities safe and helping our friends, neighbors, and loved ones stay healthy, because we are all in this together. One of the most important things you can do to help others is to wear a mask or other face covering in public. Wearing a mask shouldn't be a political statement. It isn't controversial, and it's not hard to do. Masks can sometimes get a little warm or feel a bit awkward, but wearing one in public is a simple and necessary commitment to the common good we should all be willing to make. Most of us are still staying home as much as possible. We don't need to wear a mask at home or in our small groups of people who are practicing social distancing. For example, I don't wear a mask during these media briefings because I'm with the same small group of people each time. We're all practicing social distancing and staying home, and I want to make sure that all Wisconsinites are able to understand the updates I'm delivering. But I wear a mask on my way in and out of the Capitol and any other time I'm out in public. There's so many people who don't have the luxury of taking a mask off throughout their workday or choosing when or how to wear one at all. Our healthcare workers, including my daughter, wear a mask and PPE for 12-plus hour shifts. Those who care for our loved ones in nursing homes and our first responders, not to mention the workers who interact with the public day in and day out, keeping our grocery stores stocked, operating our transit systems, caring for our kids, and more. We need these folks to stay safe and healthy to keep our communities going. And they need us to help them stay safe by limiting spread of the disease. So let's all do our part to help on those front lines. When it comes to front lines of responding to COVID-19, our local governments are really stepping up. That's why today we launched the Roots to Recovery Local Government AIDS Program, a $200 million effort aimed at helping local leaders address some of their most urgent and unique COVID-19 recovery needs. The effort is funded by $200 million in CARE funding and will be administered by the Department of Administration. Of the $200 million, $10 million will be allocated to Wisconsin's tribal nations, with the remaining funds being distributed to every Wisconsin county, city, village, and town. Although some Wisconsin local governments have already received direct payments from the federal government, we want to ensure that every community and local partner has the resources they need to combat COVID-19 and keep the people of Wisconsin safe. The Route to Recovery grants will provide financial flexibility to local communities because they know what's best, or what they know what they need and how best to address the unique recovery needs of their friends, families, and neighbors. Some of the eligible costs for local governments include emergency operation activities, purchases of personal protective equipment, cleaning, sanitizing supplies and services, including those related to elections and to elections administration, temporary isolation housing for infected or at-risk individuals, and testing and contact tracing costs above those covered by state programs. It also covers paid administrative leave for frontline public health and public safety workers who are exposed to COVID-19 and are required to isolate while they're awaiting test results or if they get a positive test result. This paid leave is very important as these workers are putting themselves on the line to keep us all safe, and they shouldn't lose a paycheck if they have to quarantine after being exposed while working to keep us and our communities safe. Our Roots to Recovery grants are an addition to the $1 billion in resources previously announced that will fund the state's response to COVID-19, including the distribution of free testing supplies, PPE, contact tracing, community testing sites, and other valuable resources for communities across the state. These increased investments in our local governments from the CARES Act will support important work, however. More federal help is needed for both state and local partners. I will continue to advocate for additional federal investment in relief and stabilization funds for our state and local governments, and will continue to work with local partners and communities so that we can use federal funding to best support local governments across our state. Today, I would also like to take a moment to recognize Mental Health Awareness Month. This has been observed during the month of May in the United States since 1949, but the importance of this designation has certainly taken on additional significance amid the COVID-19 crisis. We know the pandemic is impacting the mental health of people around the globe, as well as right here in Wisconsin, bringing about new anxieties and depression or exacerbating known mental health challenges that people face. This is not limited to adults either. The parents of children need to know about the resources that are available to them. In Wisconsin, we are fortunate to have many excellent resources available to us. One that I'd like to highlight today is a new offering by Children's Wisconsin that has been enabled by the foundation of a good corporate citizen, United Health Group. The United Health Foundation's 3-year, $2.5 grant to Children's Wisconsin is aimed at addressing a growing number of children who need immediate support amidst a mental health crisis. In the coming months, Children's will expand its offerings with a 24/7 mental health crisis response team that can provide immediate assessment and referral while improving the patient and family experience. We are grateful for an outstanding health infrastructure that includes mental and behavioral health here in Wisconsin that helps to safeguard and improve the emotional health and well-being of our citizens. We thank Children's Wisconsin and the United Health Foundation for continued innovations in healthcare so that the right services are available at the right time for those who need them. Don't hesitate to discuss concerns with your child's primary care doctor, another health profession, or a trusted resource in the community. Find a local mental health treatment provider. Text HOPELINE to 741-741 for support. And now, before Secretary-designee Andrea gives her daily update, I'd like you to hear from one of the healthcare workers on the front lines, Dr. Rachael Williams, Chief Medical Officer for Milwaukee Health Services, Inc. Rachael, take it away.
Thank you, Governor Evers, for this opportunity. I understand that the purpose of these highlights of clinical staff around the state is to help bring the COVID-19 experience to life. Our organization started talking about COVID-19 in January 2020. As a Chief Medical Officer, it is my duty to highlight health topics and public health concerns that are emerging across the globe to ensure that our providers stay well informed, especially so that we know how to educate and advise our patients. At that time in January, COVID-19 was touted as being just like the flu. However, this virus has proven itself to be vastly different than many that we've seen in the past. Like many other health providers, I was glued to the computer reviewing CDC and WHO updates and COVID dashboards and immersed in conference calls with other like entities, trying to get a handle on what our collective response to this larger than life virus would be. At first, testing was so limited and PPE was so scarce, we felt very ill-equipped with the existing resources. It was a very humbling time. As the weeks and months passed, our clinic, along with the other Milwaukee area federally qualified health centers, were commissioned to become testing sites. Testing supplies and PPE resources became more available through various partnerships, and we were glad to contribute and serve Milwaukee's most vulnerable populations through this effort. To date, we have performed several hundred tests for symptomatic patients, and we are still testing every day. Nationally, we learned about the virus, its spread, and how to decrease the risk of acquiring it. We had more information in our armamentarium to help us further educate and inform patients. We were constantly updating our processes and procedures to match the ever-changing guidance from regulatory bodies. As such, our clinic's leadership had to make the tough decision to curtail operations, relegating clinic visits to patients who absolutely needed to be seen in the office, and canceling preventive visits such as physicals, pap smears, mammograms, and routine dental visits. And although we have developed our telehealth process during this time to offer patients the ability to still connect with their provider while remaining safe in their home, the overall reduction in services financially has impacted our clinic. But we realize that financial impact is not unique to our clinic. Several businesses in our state have been hit hard. It's been a challenging time for us all. As a primary care provider, I talk a lot about prevention with my patients. We are all familiar with the axiom, an ounce of prevention is worth a pound of cure. I couldn't agree more with COVID-19. After the weeks and months of research and testing, the best remedy for COVID-19 still continues to be social distancing, wearing masks, washing and cleansing our hands frequently, and sanitizing commonly used surfaces. COVID-19 has proven itself to be no respecter of persons. We have seen both the rich and the poor affected. We have seen people in all age groups affected, and we have seen so many succumb to it despite race and gender. It has literally taken life from us right before our very eyes. And because no cure exists yet, we must not become careless in our activities and our social engagement. I absolutely understand that businesses have to start opening back up. Countless business owners and leaders are looking at how to do just that and open their businesses in the safest way possible. As a doctor, my mission is to protect my patients in all that I do. As a chief medical officer, I make it my mission to protect my staff in all that I do. I cannot fulfill either of those missions if our community as a whole is so quick to resume the normal that we once knew and forfeit the public health gains that we have seen when safer at home orders were in place. This battle with COVID-19 is far from over. And although healthcare providers have seen some improvement in testing and supplies, we are definitely not where we need to be as far as resources are concerned. As I mentioned, this journey has been humbling and challenging, but we know what to do. There is talk of a second wave in the fall, but we have to remember that our decisions today will impact what we will be allowed to do tomorrow. I do not want us to go backwards and see a rise in cases in our state. Each of us has a responsibility to ensure the improvement in our community, and I'm asking each of us to do our part. Again, Governor Evers, I am extremely grateful for this opportunity to share just a small aspect of my journey. I will now turn over the discussion to Secretary-designee Palm.
Thank you, Dr. Williams, for your dedication to your patients, to your staff, and to your community, and for sharing your story today. Today, I want to talk about testing. Testing is fundamental to our ability to box in this virus, and we've made great strides here in Wisconsin. In fact, our lab capacity is one of our success stories. Working with partners across the state, we have taken our lab capacity from 0 to well over 14,000 tests a day in 2 months. And that is important to know because that means that everyone in Wisconsin who needs a test can get a test. We want to make sure that everyone in Wisconsin hears this message, which is why we are announcing a new public service campaign today. You will hear us on the radio and see us on TV with a simple message. If you need a test, get a test. If you have any symptoms of COVID-19 or if you have been exposed, please call your healthcare provider. And to find out if there is a community testing site in your area, visit our website at dhs.wisconsin.gov/testing. I've shared the symptoms of COVID-19 with you before, but I want to emphasize that even if you are experiencing just one of these symptoms, or even if your symptoms are mild, you should still get a test. The symptoms to watch for are a fever of over 100.4 degrees, cough, shortness of breath or difficulty breathing, a sore throat, headache, chills, muscle aches, and a new loss of taste or smell. Let me underscore this because I want you to know why testing is so important to you and to your community. The reason we test is to find out vital information. On an individual level, your test result helps you know whether you need to isolate yourself from members of your household and what kind of changes in symptoms to look for. At a community level, testing and contact tracing tells us where to look for more infections, and that tells us where to send needed resources to help stop the spread. So here's where things stand today. We have 210,605 negative tests, which is an increase of 9,731 over yesterday. There are now 16,462 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 599 cases over yesterday. Our total deaths have reached 539. Testing and tracing. These are integral steps to our public health response to COVID-19. And we can only take these steps as partners. DHS cannot test and trace alone. We need your help. So please, if you need a test, get a test. Remember to stay at home while you wait for your results, and please answer the phone if a contact tracer calls you. Wash your hands frequently for at least 20 seconds and continue practicing physical distancing. We will get through this together. Thank you for your ongoing partnership.
Thank you. And we will now open it up to questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And in the interest of time, only one question per reporter per media outlet. And we'll begin this afternoon with Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for doing this call. My question has to do with the contact tracing that you just mentioned. Where is the state at with the contact tracing, hiring all those tracers, and the new software technology that's helping kind of with the record keeping with those tracers? Thanks.
Thanks, Casey. So we continue to make progress on the contact tracing front, building up those resources with our local partners so that we're able to do the work we need to do to box in the virus. We have deployed or redeployed, about 400 state employees into this effort. We additionally have hired and onboarded 100 LTE contact tracers. We did that first tranche the week of May 18th. They have been in training and are about to hit the ground running here for us. And we are currently in a second round of interviews with additional candidates, and we are targeting making offers and hiring an additional 100 out of this group of interviews to be onboarded next week so that we, again, can get them trained up and ready to hit the ground running on the contact tracing work we need to do moving forward.
Thank you, Casey. Now to Abigail Hankey from NBC 26 in Green Bay. Abigail?
Hi, I was just curious. Today we're talking a lot about how wearing masks, we need to be wearing masks in public. Are we concerned that not enough people now are not wearing them in public, and should we be?
I would say yes, we are concerned that there's probably a lack of that. Plus, we also get concerned when people don't do the other simple thing of keeping physical distance between them and others. So yes, we're going to take every opportunity we can to reinforce with people how frankly simple this is. The social distancing, making sure your hands are clean, and also wearing masks when you're out in public.
Thank you, Abigail. Now to Mark Leland from WLUK TV in Green Bay. Mark?
Thanks. I was wondering about the Route to Recovery program. Do the communities and counties need to apply for specific amounts of funding? And would counties like Brown County, that was dealing with that outbreak and a large number of cases up here, be eligible for more money? And then overall, is there an estimate for all the counties and communities across the state on how much is being spent or has been spent on items related to COVID-19?
The answer to that question is that there's several questions there, and I'll try answering some of them. The amount of money, for the most part, is based upon the number of people that live in the county. And you use Brown County as an example. Obviously, even though their numbers don't reflect the amount of effort that's taken to begin to corral the virus in Brown County, but a lot of the money that went into that, much of the money that went into that actually came from money that in the very first amount of money that we talked about that the state controls, whether it's around testing supplies, whether it's about having the lab do the testing, things like having the National Guard go to Green or go to Brown County. So it's difficult to estimate exactly that with just sitting here today, but I know we have that. For instance, I know we've spent several $1 million in Milwaukee County of the money that is allocated for state purposes because of the need that they've had in that county. So the overall amount is by the proportion of the amount of people that live in a municipality. Therefore, if you're a very small municipality, town of Algoma in Kewaunee County, you likely are going to get less than you do in the city of Kewaunee.
Thank you, Mark. Now to Mason Dowling from WAOW-TV in Wausau. Mason? And a reminder, *6 to unmute your phone. Mason Dowling from WAOW-TV. Okay, we'll move on then to Maddy Heim from USA Today Network, Wisconsin. Maddy?
Hi, thanks for taking this call. My question is in regard to the $40 million that the governor said would be set aside for procuring ventilators. And I'm just wondering two things. I'm wondering, is it $40 million to buy the 1,500 vents that you had mentioned earlier? And if so, then how expensive are these machines? And then the second part of that would be, since the Wisconsin Hospital Association data showed that we didn't use more than maybe a third of the ventilators that we have during the first wave of the pandemic. I'm just curious, why buy 1,500 more? Do you see it possibly getting that much worse in the fall?
So a couple of things, Maddy. I think one of the things we have tried to do very diligently throughout this entire pandemic is plan for the worst and then work as hard as we can to try to make it not come true. And that certainly applies to ventilators. The state of Wisconsin, the people of this state have done tremendous work to flatten the curve, to protect our hospital and healthcare workers, and make it so that we have not needed the surge capacity nor the ventilators that we all were worried that this whole, the whole nation was worried we might need. We do think, however, considering We don't yet know how this virus will continue to move, what we might see in the fall, what we might see later this summer. Again, our goal is to plan for the worst and work as hard as we can to make it not happen. So procuring those ventilators as an insurance policy is a really important piece of the work we need to do at the state to do everything we can to protect the people of this state. I will say to you that the specific numbers are not in my head, Maddy, but we certainly would be happy to get back to you on those particular pieces of the question that you had. But this is absolutely an important part of our response, and we do think that procuring those ventilators is a really important insurance policy for us moving through this pandemic.
Thank you, Maddy. And a reminder, in the interest of time, and so everyone gets a chance for a question, only one question per reporter per outlet. We'll move on then to Hannah Jewell from Fox 6 Milwaukee. Hannah? Hannah Jewell?
Hi. Today at the Bay of Sheridan in Kenosha, a long-term senior care facility, we learned that there were 6 fatalities in recent weeks due to COVID-19. We're wondering how often is the state seeing large fatalities at these facilities, and have we seen deaths at long-term care facilities decrease in recent weeks? Thank you.
So, as you all know, we have started over the past number of weeks, I lose track of how many it's been now, have been updating on a weekly basis our investigations and outbreaks webpage to include the settings in which these facility-wide investigations are happening. Long-term care has been a priority for us since the very beginning of this pandemic. We saw from other states here in the U.S. as well as around the globe that folks living in these congregate settings were at higher risk for severe disease, and we have wanted to work as closely as we can with our local partners and with the long-term care community to protect those folks as much as we can. We certainly have seen and are seeing outbreaks in long-term care facilities. You can see it as well on our website, and our goal with the testing initiative, our testing priority, is to double down on our efforts to work with these communities to protect as much as possible the folks who live in these facilities. But also, as you know, the burden of death and disease from COVID-19 has fallen on older folks here in Wisconsin, just as it has around the nation. I don't know, Dr. Westergaard, if you want to say any more.
Yeah, I guess specifically about deaths, we've a small uptick this week. We report deaths as all deaths known to be due or suspected to be due to COVID-19 are reported to us through surveillance. There's been usually single to digits to low tens or teens numbers of cases overall. So we haven't seen a huge increase in deaths. I just looked at our most recent data, and you're right. The number of deaths occurring in people living in long-term care facilities is pretty substantial. It's 41%. So it speaks to why that is such a high risk environment with a high risk patient population, and really demands that we pay a lot of attention to infection control in those situations, and doing a widespread testing initiative is a good piece of that initiative.
Thank you, Hannah. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks again for doing this call. With the $200 million program announced today, is there any of the federal CARES money that was allocated to the state that you have not earmarked for anything yet? And of the money that you have announced, has any of it actually gone out the door?
That is a great question, Scott, and I do not have that information. I don't know if anybody else around the table does.
So Scott, there definitely is a piece of that 1.9 that is left. You will hear from us in the coming week or so with some additional announcements, but I also think it's important for folks to appreciate, as we have with this pandemic all along, it has evolved. We have learned things. We certainly want to make sure we're prepared for anything that happens this summer or into the fall. And so we'll want to make sure we have resources to allow us to be nimble and agile and respond to the way this pandemic behaves moving forward.
Sure, and this is Ryan Nilsestuen, Scott. So of the, there's been a series of announcements in terms of these larger programs, whether it's assistance to healthcare.
Wausau. Heather? Heather from WSAW-TV. Okay, we'll move on then to Bruce Marcus from WRJO Radio. Bruce? And a reminder, *6 to unmute your phones. Bruce Marcus from WRJO Radio. Okay, moving on then to Rachael from TMJ4 in Milwaukee. Rachael?
Hi, Governor Evers. What's your opinion on whether the 2020 state fair should be held or canceled?
Well, that's certainly up to well, it was up to the State Fair Board, and now they have, as I understand it, yesterday voted to empower the board chairperson to make that decision. It's a difficult decision to make. Personally, my wife and I have gone to the last state fairs for the last 51 consecutive years, so it is certainly a major part of our life and has been. And we're looking to go again at some point in time. But I'm sure that the chairperson of the board also is thinking about the fact that we're bringing lots of people together. And this isn't a small family group together, but tens and tens of thousands of people every single day at the state fair. As I said, I've been there 51 consecutive years, and there was not a lot of social distancing during those 51 years. And I'm guessing there isn't enough space to do a lot of social distancing. But that said, it's a decision, a very difficult decision that the chairman of the board will be making.
Thank you, Rachael. Now to Bram Sable-Smith from Wisconsin Watch. Bram.
Hi, thanks for taking my question. This is for Governor Evers. Governor, states are permitted to provide pandemic unemployment assistance to people who otherwise would not qualify for regular unemployment compensation. So the question is, why not allow people on SSDI to receive the PUA?
I guess that question I can't answer. The federal government made some changes so that members of the gig economy and others that have not been eligible in the past, but why they didn't make those eligible, I can't answer. I can't answer that question at this time. I'll get an answer for you, but it's not one that I have at the top of my head.
Thank you, Bram. Now to Steve Prestegard from the Platteville Journal. Steve?
Thanks for taking my question. This is for Secretary Palm. In our area, we've had several swimming pools owned by municipalities. The decision was made to not open them, and there are others that are waiting until June to make a decision, maybe to open up around the 4th of July. What guidance has the state been providing other than the question of allowing no more than a certain number of people into a pool? Are there other things that the state has been recommending to municipalities about what they should do and not do regarding municipal swimming pools?
Yeah, thanks for that question, Steve. Lots of folks certainly are asking it. Has that guidance gone public yet? Are we still working on that?
We have a sort of general safe, social distancing that applies to like that, but not a specific document related to pools that I think is out yet.
And does WEDC have one?
I think they do.
I think WEDC has one as well.
Thank you, Steve. Now to Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. My question. My question is around the number of outbreaks and investigations that are reported on the state's website. So in Racine County, we have about 49 total investigations, and on there, it's listed with just 2 of the facilities. Can you kind of give me a framework of how you decide which facilities are reported out and which are not, and why?
So I will admit to you that I do not have the computer in front of me, so I'm not looking at what you're looking at, but Our definition of an investigation for a long-term care facility is a single case, and that, as we have talked about many times, is because of the vulnerability of folks who live in those facilities and the partnership we have with that community to do all we can together to keep them safe. For other investigations that we are tracking and are publishing, it is 2 or more positive cases, and so that is the information that local public health is reporting up to us. That is how those facility-wide investigations get on the package that is updated on a weekly basis. And so what you're seeing in Racine County reflects what has been reported to us based on those parameters.
Thank you, Denise. Now to Mel Alonzo from CNN. Mel? And a reminder, *6 to unmute your phones. Mel Alonzo from CNN. And we'll move on then to Brendan Cullerton from CBS 58 in Milwaukee. Brendan?
Hey, thanks for taking my call. I've got a question for Governor Evers. How have your conversations gone with professional sports teams like the Brewers, Packers, and Bucks about playing this year in some capacity, and what could the state's role be in that process?
Well, our role in the process is to provide advice around social distancing and the other parameters that we think are important. I've talked to leaders or communicated with leaders from the Brewers, Major League Baseball, the Packers, the Bucks. I may have been missing some, but so anyway, they're ongoing discussions, and they're keeping us informed as to their progress. But as far as us putting any parameters around that, I'll go back to what I said earlier: is that we are not in the position of putting parameters or any type of restrictions. That was taken away from us when the Republicans took us to the Supreme Court. That said, we're more than happy to discuss issues about social distancing with anybody.
Thank you, Brendan. Then now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. My question is about state finances. I know last month the state tax collections were down several $100 million, and I can't imagine they will have caught up by the end of May. I know that, Governor, your administration put in place a 5% cut across the board. I'm wondering what measures you're discussing or considering in terms of making ends meet with potentially lower tax revenues coming in.
Yeah, that 5% was just the beginning. We are continuing to look at all the alternatives available to us to reduce spending this fiscal year, and how that will look going forward in the next fiscal year. Clearly, we are waiting for a report in early July as to the closing of the fiscal year that we're in to make further decisions. But this is ongoing with all the folks that are leadership in state government.
Thank you, Ben. Now to Riley Vetterkind from the Wisconsin State Journal. Riley?
Hi, thanks for taking my call. It's been about 2 weeks since the Supreme Court struck down the Safer at Home order. I'm just wondering whether you're able to attribute any uptick in new COVID-19 cases to the order being struck down.
Thanks, Riley. Obviously, we're watching our data on a daily basis and continue to ask the people of this state to continue to help us maintain the kind of physical distancing, the kind of practices that we have been doing together to keep the curve flat, to help keep continuing to protect the people of this state, particularly those who are most vulnerable. I think we would not feel confident saying that on the 2-week anniversary, we are attributing increases to the lifting of Safer at Home, but we certainly will continue to track the data. We obviously are concerned about outbreaks and hotspots around the state. We are concerned about the slight increase in hospitalizations that we're seeing in parts of the state. And those are all things we're watching very closely as we do the work of continuing to ramp up testing and tracing so that we can do the kind of boxing in that we need to keep everyone as safe as possible, considering increased circulation, increased contact among the people of this state.
Thank you, Riley. Now to Stephanie Hoff from WisPolitics. Stephanie?
Hi, and thank you for taking my call. My question is for really anyone, either Secretary Palm or Governor Evers. But what would you like to see the money spent on by local governments related to COVID-19? And what if they spend it on something unrelated?
Well, they would be required to spend it on something related. That's first of all an easy question to answer, but they do. They've incurred expenses as it relates to elections. Putting in the plastic pieces and making sure that the elections are safe. So I think no matter how small the municipality, they're doing something that's related to COVID-19.
Thank you, Stephanie. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Hi. This question, I believe, would be for the Ryan Nilsestuen. Here in Racine, the explanation for why the local orders related to COVID-19, as well as in Milwaukee and Madison, is that the Supreme Court's decision was based on the how the statewide order was enforced and not on the order itself. Is that your reading or the administration's reading of the Supreme Court's majority decision as well, or did you understand it differently? Thank you.
Sure. This is Ryan Nilsestuen. So the Supreme Court's decision was based on two parts of state law. One is Stat 25202, which is DHS's longstanding powers in order to issue orders to protect public health during a pandemic. The Wisconsin Supreme Court, at least 4 justices of the court, held that any order issued under that provision is actually a rule. So they interpreted the word order to mean rule, and therefore had to go through administrative rulemaking under another part of the statute, which is Chapter 227. The Administrative Procedures Act. And local governments have separate power under 252.03, not 252.02, and those same rulemaking requirements do not apply to local governments. So the rationale that the 4 judges used to strike down the state's ability to respond to the pandemic doesn't respond to local health officers.
Thank you, Adam. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi. I just heard Secretary Palm say that you're not comfortable with attributing the uptick that we kind of saw in this one day today from yesterday and the increase in hospitalizations to the safer at home order being struck down. Can you attribute it to anything else, or is there anything that you're looking at that could have attributed to this uptick we're seeing today?
Yeah, so I think, we also saw for the first time today our number of tests go above 10,000, which is another milestone for us. Our highest day previously was 9,400, 9,500, something like that. So we certainly have done the most tests, and so therefore the most results in a single day. But Brian, if you have other thoughts you want to...
Well, I think the question is, it's not really ever going to be possible to attribute something like a trend, especially on one day, to any one thing. The things that determine the movement and the speed and the size of an epidemic are extremely complex, and you could never say one thing caused it. So the standard of saying that anything causes something else in science is really high. But it might be helpful to answer the question like this: is that all 599 cases that were diagnosed today resulted from a person being in close contact with another person who had the infection. And that's the only thing we can say with certainty. Are there more people with the infection than there were a couple weeks ago? The answer is probably, given the overall trends. We would say with some uncertainty that there's more people in the community right now than a couple weeks ago that have the infection. And the other thing that it's fair to say is that we don't know who those people are. So in the community, anytime people are in close contact with each other, there's some risk. And the risk varies from region to region, city to city. It depends on how close the contact is. But our guidance, our recommendation for everybody to stay safer and to help stem the spread of the epidemic is really to understand that it's close contact, it's frequently touched surfaces. And and just like there's not one explanation for why the epidemic looks the way there is, there's really not one thing that can help us prevent it. It's the combination of things that we've talked about. And probably the single most important thing is close contact. So 6 feet of physical distancing. Masks decrease how many respiratory droplets and therefore potentially infectious particles get out into the environment. So that's another thing that can lower the risk that someone will come in contact with the virus, not to zero. Other thing are frequently touched surfaces. If we're very diligent about limiting how frequently we're out touching commonly touched surfaces and sanitizing those and doing things like not shaking hands and hugging and kissing when we greet somebody, these are all things that take that risk, which is really hard to estimate precisely, but we know that it makes them lower. And the more of these things that we do in combination with each other, the safer that any person can be. So I think we really need to think not in terms of did this cause the cases to go up, did this cause the cases to go up, but to understand that it's complex. And we have to do a large number of different things in order to respond to keep ourselves safer.
Thank you, Danny. Now to Ruth Conniff from Wisconsin Examiner. Ruth?
Hi, this is Emily Davies from WSAW. I apologize for cutting in later. We had some technical difficulties on our phone
we
call.
Called on.
If you want to let the other person first, but I just wanted to let you know that we are on the call and we want to still ask a question.
Ruth, are you there?
This is Ruth. Can I ask my question?
Yes, you may. Sorry about that. Go ahead.
Okay, so thanks for taking my call. My question is, Senator Chris Kapanga said today in a hearing that state workers are being paid to stay home and not work. Could you comment on how many state workers have been paid to stay home and not work during the pandemic?
I think it's about 0.
Yeah.
Thank you, Ruth. Now to Pari Cruz from Telemundo. Pari? And a reminder, *6 to unmute your phone. Pari Cruz? Okay, we'll move on then to Mary Spacuzza from the Milwaukee Journal-Sentinel. Mary? Mary Spacuzza?
Can you hear me okay?
Yes, we can.
Hi, thanks for taking my question. We are hearing concerns about increasing hospitalizations in Milwaukee, and I know some other areas have reported that. I know you touched on that, but do you have any additional information you can share about what you're seeing in terms of more people being hospitalized and where, and any information on why?
So the hospital, or what is the moniker? Facility capacity, I think, section of the website has beds in use as well as ICU beds in use. But we are certainly seeing an increase in hospitalizations, not at all to a level that hospitals are needing to employ their surge plans or feeling overwhelmed, but it is absolutely something that we're watching. The website does break it down regionally, so you can look in some amount of granularity about where in the state we're seeing it. I don't know, Ryan, if you want to add anything to that.
Yeah, we have the ability to sort of look at it while we're talking here, and the overall number of hospitalizations, and it comes from the asking hospitals on a daily basis how many people are an inpatient with COVID-19. It's again, one data point doesn't make a trend. Overall, this week looks to be a little bit higher than the week before, But the peak in terms of how many people were hospitalized at any one time, looked like it was sort of the highest in early May with about 320 people hospitalized at the same time. The date today is 290, was yesterday 295. So it's too early based on any one experience to call it a trend. We at the state are trying to aggregate over a large amount of sources of information. And the best thing to do to dive into that is to really look at the website that we're looking at here.
Thank you, Mary. Now to Sophie Bolich from the Cap Times. Sophie?
Hi, thanks for taking my question. So obviously the phase 1 of the reopening plan in Dane County just started yesterday, Tuesday. I just wanted to know how you think it's going and what are you looking for in terms of moving forward towards the next phase? Thank you.
So I would certainly encourage you to talk to Janelle, the public health officer in Dane County. I think, like all of this stuff, one day certainly is does not a trend make. I think Dane County, like other municipalities and locals around the state, are looking closely at their own data, understanding that they now are making decisions about how to proceed for the safety of their communities, and we are working closely with Dane and with other counties as they proceed. I think Janelle would certainly tell you that they feel very comfortable with where they are, with their ability to do the work necessary to test and to trace and to control the spread. And we stand ready, obviously, to help them in any way that they need moving forward as they see their data change and evolve as they move through phase 1.
Thank you, Sophie. Now to WBAY TV in Green Bay. WBAY? WBAY TV. And moving on to WISC TV in Madison. WISC? And a reminder, star 6 to unmute your phone. WISC in Madison. Okay, moving on then to WISN in Milwaukee. WISN?
Hello. There is a school in southeastern Wisconsin that's planning on having an in-person graduation even this weekend. Quickly, is that even legal based on the Safer at Home order? I know the Supreme Court didn't touch schools. Is that allowed, or do you recommend that?
Well, I'll answer the second question, and if it is possible to keep socially distant and making sure that everybody is wearing a mask and that people are using the appropriate hygiene, I suppose it's possible. I mean, frankly, that's a decision a local school board is making based on their belief. It would be our hope that it's done in a way that takes into account what we know about science and what we know about this virus.
Thank you, WISN. A couple who we did not hear from, though we called upon them. Bruce Marcus from WRJO. Are you there now? WRJO Radio. Okay, and finally, Heather Poltrock from WSAW TV in Wausau. Heather?
Hi, thank you for circling back to me. My question is, a food processing plant in our area known to employ a large percentage of Hispanic people announced 3 COVID-19 cases today. Statewide, Hispanic people account for 33% of COVID-19 cases. How many Spanish-speaking contract tracers does the state employ, and are they able to meet their current demand among the Spanish-speaking community?
Thanks for that question, Heather. I will tell you that one thing we certainly have learned and that is laid bare by this pandemic is the health disparities that are really able to be seen in spades because of this pandemic. We, as it relates to contact tracing, in that first tranche of the 100 LTEs that we hired and onboarded in mid-May, we made a hard push for bilingual contact tracers, and of those 100, more than 25% of them are Spanish speakers, and that was because, to your point, one of the things we have seen here in Wisconsin is a need for Spanish speakers to do this contact tracing work in a way that is most effective and efficient and meets folks where they are as it relates to their comfort with the language. And so we have brought on board additional Spanish-speaking contact tracers and are deploying them where they are needed to do this work, whether it's, I think you mentioned a meat processing plant or other settings where a bilingual contact tracer can do that work effectively moving forward.
Thank you, Heather, and thank you for joining today's media briefing. Please continue to monitor the DHS COVID-19 web pages for information, data, and guidance. More information can be found on the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, Wisconsin Economic Development Corporation, and the Department of Children and Families. Thank you, and have a good afternoon.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate, WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.